Hello, and welcome to another episode of Cutting Edge Health. Today, we're going to talk to you a little bit about something that's unique, and that is the concept of green light therapy. So, as I was taking a look across a couple different articles, I came across an article that was talking about green light therapy for the utilization of improving migraines. And as I started looking more into that literature, it seems like there's a value that's present there. So that's what we're going to talk a little bit about today. So when we take a look, we can be able to see there's an article that took a look at research that was published by the University of Arizona. And one of the things that they saw at that University of Arizona research is the following, is they were able to see that patients that had migraines that were pretty intense, they were exposed to green light. And when they're exposed to green light over a number of days per month, they were able to reduce their headaches by greater than 50%. And that was with people who had severe headaches, where they had headaches fairly frequently, anywhere from episodic migraines, which were 86% of the participants, to those who had chronic migraine, which was about 63%. And what they were able to see is the average benefit was statistically significant. So let me kind of hone in on what that means. What that means, again, is so when we take a look and we review the literature, right, what we're looking for is not it just being happenstance. Oh, maybe it was luck, or maybe it just happened to be where this was the case. But at the end of the day, what we want to see is that when we look at this and we analyze this from a statistical standpoint, can we actually be able to see that there's a difference that's in place? And with that, that's what they were able to see within this particular context, is that we're able to see a statistically significant component that was present. So when we take a look at this, it ends up that it was mainly done by the University of Arizona. For those of you who follow our channel, we can be able to give you the link to the literature. And the initial study, which there's been more than one study from what I've seen, looked at about 29 people or so. And they'd had tried other therapies. They tried medications, like oral medications. They tried Botox, and it wasn't significant enough to provide them some degree of relief. And it's interesting because there's a couple different papers that looked at kind of a conversation with patients themselves. And many of them felt like, oh, there's no way this is going to work, and were pleasantly surprised. So kind of giving you the understanding about what was actually put forth is that patients were exposed to traditional white light. This is kind of the control. This is where they see whether just being exposed to light doesn't make a difference. But exposed to white light for 1 to 2 hours a day for 10 weeks. And then they took a break, and that break was about 2 weeks long or so. And then they were exposed to green light for the same amount of time for 1 to 2 hours for 10 weeks. And what they were able to see is that there was a definite reduction in pain from if the patients originally started off with a pain score of somewhere around an 8, where they were able to be reduced down to a pain score somewhere around 3.2. So that's a pretty significant reduction. And I know I probably have a number of patients that are watching or that will watch, and they'll ask the same question that I think was in my head. Well, does it only work for migraines? And I think that there's potentially some utility behind it not just working for migraines, right? And we're going to talk a little bit about that in just a second or so. But as we kind of get into the context of this, one of the things that we want to see is, so how does this shake out? And so what the researchers said is, you can do a lot of different things, but you can get an LED light for cheap. And if you can get an LED light that is able to give you that green light, quote unquote, right, you can be able to potentially improve your pain by a significant amount. And this initial paper was published in Cephalgia, which is a journal that looks predominantly at headaches. And the fancy title for it is, it was published by these researchers that are present in Arizona. And it's an evaluation of green light exposure on headache frequency and the quality of life, right? So when we take a look and we kind of get into the full gist of that, kind of a synopsis of that is this very paper that we're taking a look at right now. So what we're going to do when we take a look at this paper, which hopefully kind of give you guys some insight. And so again, initially, let me be clear. We're talking about the utilization for headaches, but is there more of an application? We're going to talk about actually a tool that you might be able to avail yourself of. But besides headaches, maybe there's something even more well-versed than just headaches alone that can be able to give you some improvement, right? But what we're going to talk about is this paper that looks at the context of the original paper, right? So the original paper, like I said, it was 29 patients. They were having multiple episodes. They had pretty prominent migraines that were present, and they used a crossover design. And that crossover design, as I kind of alluded to earlier, is in essence where you say, okay, well, we're going to have a patient be their own control. They're going to try the control of just white light for a little bit for 10 weeks or so. They're going to take a break, and then we're going to try green light for 10 weeks or so, and then see how it works. So when that's the case, what they were able to find was the following. So when you take a look at it, basically what they were able to see is that the number of headache days in people with episodic migraine were significantly reduced, right? They were significantly reduced from just using a simple diode or LED. So what many times we want to know is not just the context of did it work? We also want to know, is it safe? Were there any other side effects that were associated with it? And what we're able to see is that there weren't any side effects. So when we take a look, what we are able to kind of deduce from this is the following: is no adverse effects were reported. And these were from patients who probably want to try not having to deal with medications because the medicines were so problematic, right? So let's kind of give this to you from a different perspective, right? So when we take a look, this paper is a little bit further back, but it's kind of from the elements of a patient perspective. So it was a patient who was dealing with chronic pain, and she's 69 years of age. And one of the things that she was looking at was green LED light, like we just discussed. And so she uses a string of green lights near her to be able to cope with crippling pain. And in this context, it's for interstitial cystitis, which, as you guys know, is completely different from us talking about headaches. And I'm not saying that green light is going to take the place of medicines. It's going to take the place of injections. It's going to take the place of surgery if you need it. But the fact of the matter is what's the downside? If you do it and it doesn't work, who cares? But going on, let's take a look at this paper, or rather this article that talks about this a little bit in depth and detail. So what she did is she used this based off of the paper that we just kind of talked about. That's from Dr. Mohab Ibrahim from Tucson, Arizona. And what they have subsequently been able to kind of extrapolate this is that it may benefit with some of the most challenging pain states that are out there. So specifically here, fibromyalgia, migraines, and interstitial cystitis. And to me, I think that's where this becomes even more valuable. When you can talk about it being able to be utilized outside of the context of the migraine space, maybe this provides us more utility than what we originally realized. So when we say, okay, it's non-invasive, it's not traditional medication, and what we can see is that it doesn't necessarily interfere with anything else. This particular person, what she did is she used it for about 20 minutes as opposed to the hour or two, and she uses it ongoing in a consistent way in order to be able to get some degree of benefit, right? So as they state here, do you really need to use it for 2 hours? Maybe it could be less. For each person, maybe there's some differences between 15 and 30 minutes. And those things are what are able to provide some degree of benefit. One of the other things that they've said is that they're using this also to try to treat neuropathic pain, so nerve pain that sometimes can be associated with HIV. And if it's able to be able to provide benefit for HIV neuropathy, then maybe there's value to it being able to provide value for um, pain that's neuropathic in nature. So I think there's a question that has come up. I'm sorry I didn't address this earlier. And so it's kind of like spaced over two parts. So let me sort of show this. So what is intercostal cyst? And I know it was kind of actually requested, what is interstitial cystitis? So interstitial cystitis is actually an issue and pain with the aspect of the bladder and pelvic region, right? So you have painful area in that region, which historically has been treated by doing different things like either a hypogastric block in that area, or you can be able to look towards using different type of stimulators that sometimes urologists would use, or depending upon the pain practitioner, in the maybe 10 to 15 years or so ago, we used to do retrograde spinal cord stimulators going down to the sacrum region. But nowadays, being able to use either a more prominent program that would be something like either dorsal root ganglion, or at the site at probably S1 to S3, or a stimulating pattern that uses some form of burst or high frequency, may be able to kind of mimic some of those same results. So hopefully that gives you kind of the answer to that question. Okay. So going back to that aspect of the paper, one of the things that we want to kind of talk about is, so how did they come to all of this, right? And what does this really sort of mean? So if we take a look at this particular insight, it gives the voice behind the researcher. So what it says is, but if pain works through the nervous system, how exactly can green light, which works through the visual system, make people better? So let me kind of read that again for you one more time. Stick with me a little bit. I know you guys are kind of dropping off, but hang with me for just a little bit. I think this might be pretty useful for you, okay? So what it says is, if the pain works through the nervous system, how exactly can green light, which works through the visual system, make people feel better? And so what they say is the following: is the effects of green light on the brain have been researched and well documented for years. And green light can reset the circadian rhythm through melatonin, the hormone that regulates our sleep-wake cycles. A special photoreceptor system in the human eye picks up the light and elicits non-visual responses, sending signals to the brain to reset the internal clock and altering melatonin production levels. There are some other theories that are out there that talk about perhaps there are neuronal connections that span from the retina to the spinal cord, pass through the brain, and that these control and modulate pain. And that green light changes the levels of serotonin and alters the endogenous opioid system. So what does that mean? What it means is it uses our natural pain-killing mechanisms by using light in order to affect that. Okay, so are there products that maybe exist out there, so that, let's say you didn't want to do LED lights, that might be able to show you some degree of value? Well, I came across it as I was looking this up and wanted to present it to our audience. Well, there are, and I really didn't even think about this, but there are glasses that exist. And so there are glasses that exist. I'm going to be quite frank with you. I don't know whether this works or not. I've never prescribed to patients. I have no idea about the validity behind it, but we're going to kind of go through it on this video to give some further insight about how this might be useful and exactly what might be able to provide some degree of relief. All right. So when we take a look at this particular site, it's called MigraLens. Now, again, as you know, it started with the context of us looking at this mainly for migraines. So they talk about MigraLens versus blue light glasses. And what they're able to see is that what happens is the lens itself of these particular glasses have a distinctive green lens color. And the reason for that is it blocks out, in theory, or filters light that triggers and worsens migraines, possibly concussion syndrome, vestibular disorders, and other conditions that may make chronic headache or light sensitivity problems worse. So blue light is different. It comes from computer screens or fluorescent lighting, and is recognized as a common trigger for migraine. However, so it's light on the red end of the spectrum. So there are different other types of things that are out there, but microlens, as you can kind of see from this picture, what it does is different, is it actually filters it. So that it filters light, and in essence, basically what it says is that it reflects blue and red light, right? And that's what causes the lens to appear green. And then from there, it allows that there's a green light that kind of passes through, if you would. So here you can see the spectrum that occurs that allows for the wavelength of lights of what they block and how they're able to then have it pass through. So it may be able to be preventative. And 90%, according to this, of people who use these glasses prefer just compare it to their other glasses for improvement in migraine severity. Supposedly, they have an 80% improvement in reducing the headache impact score, and there are a number of entities that support them. So to me, I think as we look at different therapies that potentially can give benefit, right? And we say, okay, what can we do that can be able to have us take control of pain as a pain patient or someone who cares for a pain patient, and to be able to say, if we can get a set of glasses or we can get an LED lens or LED lights and put that in combination to what we're using for our traditional therapy, maybe that ends up giving us some reduction in pain, 15%, 25%, who knows? And it very well may not work for you. As we saw in the paper, it didn't work for every one of those subject members, right? But it did work for a good proportion of them that was statistically significant. So to me, I think this is an alternative to try as an option. For many of you guys who follow me pretty consistently, I know you guys are like, what's with the fancy get up? And then also, you're not in your office regularly. You're correct. I'm in Puerto Rico. We're doing this healthcare evaluation for how the healthcare system works down here to kind of learn more about how to be able to do some things in other places, like back in Indiana where I am. And it's been a really good trip learning about things. And so while I was here and getting a little bit more light and sun, I was like, how does that factor with what's going on with my pain patients? And so seeing as how these two kind of come together, really pretty useful. I see that there's some questions that are kind of coming in. I don't think there's anything that's coming in yet about green light. So I'm going to kind of hang around and sort of wait for that. But let me tell you about some other things that exist that may be useful from a different perspective. So one of the things that has been talked about is, instead of us just looking at neuromodulation, which historically has been focused on the utilization of affecting the context of mainly influencing nerves for pain, maybe the utilization of what happens in our eye might be able to provide some degree of pain relief as well. And so there's a number of different components that are out there, but there's one lab in particular, which at the moment I'm not seeing pop up on my computer aggressively, but there is a lab that's present at Stanford that's looking at, can we use what happens and how we see to be able to improve what's happening with our pain. Okay, it doesn't look like there's anyone else who's jumping on right now. So if there's any questions, we'll give you another 5 to 10 seconds, and then I will see you next week, and we'll talk about another topic that is dealing with pain. Thank you so much for joining us as you do every week, and hopefully we were able to provide you some value. If so, please hit the like button so other people can see it. And if you think this might be useful for others, then possibly share it with someone. Okay, it looks like Jenny Singer's asking, do you mean green LED lights that you put up for decoration? Yeah, so it seems like from what we're seeing is they didn't describe the nanometer wavelength of light having to be fancy. So yeah, I think you could be able to try green light that's close to just a traditional like decoration type light that you expose yourself anywhere from 20 minutes to maybe 2 hours with consistency though. So you'll have to do it on a daily basis for about 10 weeks or so and see if it gives you some degree of benefit in addition to what you regularly do. I think there's some well wishes from some of you guys that are saying enjoy, and thanks for being, making sure that I'm giving you guys a live stream even when I'm away. We're definitely going to do that, no doubt about that. So if there's any other further questions, please submit them in chat, and I'll try and see what I can do about answering them. And more importantly, if there's other topics that you want me to cover or talk about or look into and research, submit those, and then we'll see if we can be able to give you some insight about how to be able to address those issues, how to be able to punch pain in the face and get back to leading the life you deserve. All right, thank you so much, guys. Have a great day.